sometimes I literally feel like I can still do a cartwheel, but sometimes I just want to jump for joy when we speak to some of these founders. And today, speaking with Jamie and Cynthia, the founders of Winx Health, it was one of those moments, they refer to a pinch me moment, but almost a pinch me moment for us, I think, where you are so inspired by the energy and the progress and the business that these two women who are, maybe a hair over 30, they have won the 30 under 30 prize, and we're looking at it and they were mentioning it wistfully, but literally these people are going to be in the business world making a difference for decades.
Yeah, no, their energy was literally palpable. I absolutely love their founding story because it is so very personal. Let's take a listen. Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun Scherl. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so delighted to have our guests today, Jamie Norwood and Cynthia Plotch, who are the co-founders of Winx Health. They have quite an interesting story and couldn't have picked a better time to jump into women's health. So we're delighted to have you today.
Thanks. We are so excited to be here.
We would love to hear just how you got here. We always dig into the background because we love this stuff. But you started several years ago, and here you are, still making a statement and expanding your portfolio. So tell us a little bit about the buildup to get here, the inspiration or the moment.
Yeah, so Cynthia and I started Winx in 2019. We had both had really bad experiences buying really like over-the-counter women's health products. Cynthia in particular had an experience that really like led us to start this company, which I will let her tell you herself because she tells it perfectly.
Because I was the one traumatized by it. So yeah. So Jamie and I were working at another consumer startup, and I always say there we fell in love with creating better experiences for female customers, but also with working together, which Jamie always rolls her eyes at a little, but I mean it every time. Um, but it wasn't until I was buying a pregnancy test and ran into my ex-boyfriend's mom that we had this moment of realizing how incredibly broken it is for us to access the products that we need but dread buying. And I, at the moment, ran out of the store, called Jamie in tears to commiserate about this freaking awful experience I had just had. And it quickly helped us realize, how much opportunity there was, how much of a problem this was. And even though 7 years later, we are so much more than a better for you pregnancy test. We now do comprehensive vaginal and reproductive health products. That core element of making you feel better in these difficult moments has definitely held true.
And I think so many people probably who are listening, regardless of what brings you to the podcast today, has that moment. I felt my stomach muscles tighten when I read about it the first time. I think we've all had experiences, whether it was with sexual or vaginal health products or just being in conversations and people entering that we didn't necessarily want to be there. What I think is so exciting is it was such an insight, like it was such a visceral reaction. And what's so exciting about being in this space is you said, well, I had this reaction and now I'm going to create a company, which is what distinguishes people we find in women's sexual and vaginal health, which is how you talk about the company, reimagining vaginal and sexual health. So
I was curious. So did you start with pregnancy tests? I know that your company used to have a different name. So maybe you could go into that a little bit because it definitely confused me as I was looking up your old company name and getting a whole lot of golf clubs to look at. So fill me in.
Yes. So when we started the business, it was under the name Sticks. And we chose the name Stix because our first product was a pregnancy test, also in stick form. There is a golf club company with the name Stix. Over the past few years, our business has really expanded to be more than just pregnancy tests. We make products and sex and health education for a wide range of vaginal and reproductive health. So we have UTI products, yeast infection products, we have emergency contraception, and we just felt that we needed a name that better encompassed what it is that we're building. And Winx Health is our name now. We launched the new brand in June 2024, it's past summer. And it's really like the Winx is a wink or nod to let our customers know we're really in their corner. And everything that we do and we're building here at Winx is really informed by our own experiences as female consumers. So like we were just talking about, we started with pregnancy tests because at that time when Cynthia ran into her ex's mom, we were in our mid-20s. We did not want to have children. And we felt that there wasn't a brand that was selling these products for women who didn't want babies. Like they're all very fertility focused. You see babies on the boxes. The marketing is like happy couples. So we really wanted to carve out a space for women in our life phase at the time to feel comfortable buying these products.
Sure. You have a real collection of products. So I'm just curious, do you just find products that already exist and then promote them on your site? How are they vetted? Are they clinically studied? Because, it is so hard to be in so many different spaces, even though they're all under the umbrella of women's health.
Totally. We have developed some really exciting innovation of our own. So definitely have products that are unlike what you would get on the shelf today or from other brands in the space. It's hard to feel like it's like picking a favorite child, so it changes every day. But today, my favorite product is our UTI test and treat, which we actually just launched earlier this year. We just won Time Best Invention of it for it as well.
Congratulations.
Thank you. It's really cool because, we did start with a pregnancy test and now we have this product that doesn't just help you understand what's going on with your body, but actually gives you a diagnosis and connects you to the next step, which is accessing a prescription treatment. These products haven't had an upgrade in a century. We love to say like we're not your grandmother's products anymore because what we're doing is we're taking these physical products and combining them with this digital health component that really lets you take control of your health, keeps you from going to urgent care, keeps you in control of that whole experience.
And one reason why we focused on this test and treat aspect is that, accessibility is such a huge problem in our country. Over 50% of counties don't have access to an OBGYN, and a lot of people are uninsured or underinsured. So we wanted to create a product that lets people learn about their health and test for these infections at home and direct them to a telehealth doctor. And the cool thing about telehealth experience that we're providing is it's all for less than the cost of most copays. So it's $15 for that doctor's appointment, that digital doctor's appointment. So it really narrows this gap in accessibility.
Yeah, I know Rachel wants to talk dollars and cents. I have a couple of a comment and a question. So,
Yeah.
funny story of course, during the pandemic, telehealth became so popular. I have literally treated women for UTIs as they sit under their desk in their office because they don't have time or the access to get to the doctor. So kudos to you for making that way easier. But so is it physicians? Is it nurse practitioners? How do you vet your providers so that you're sure they're getting appropriate care?
Yeah, so the most important thing to us is actually, well, there's a lot. Obviously we work with board certified providers. Everything is done asynchronously to keep it really easy. And we work with a telehealth provider called Dr. B to make that all happen. But something I think that really differentiates our telehealth experience is centering on the diagnostic. We're not just having you self-assess, there's some burning, because let's be honest, that could be a lot of different things presenting in a lot of different ways. But we actually have you take a test that is, FDA certified, FDA approved, helps you really get that answer and help you understand what is going on in your body and then access the treatment, again, to maintain these kind of clinical rigor and clinical standards.
Here's today's hot flash. After a single UTI, 30 to 44% of women will have a recurrent infection. 50% will have a third episode if they've had 2 UTIs in 6 months.
I want to go back to something Alyssa said before. You know, the products are all branded under Winx.
Mhm.
So can you describe a little bit more about that process and the testing those? I think where Alyssa was going is what testing those products go through. Obviously, many of them require FDA, if not approval, at least clearance.
Yeah. We sell a combination of devices and over-the-counter drugs and supplements, which you all definitely know have all sorts of different, regulatory standards that they're held to, whether it's supplements, which have honestly loose regulatory standards. And so we hold ourselves to a much, much higher bar, starting with choosing our ingredients and formulations, working with specialists and physicians to help develop those, whether that be urologists or gynecologists, depending on the supplement, all the way up to over-the-counter drugs, which are heavily, heavily regulated. And obviously, we work with the FDA on that side and kind of medical devices in between. So yeah, I think, when we look at products, we obviously the regulatory piece is incredibly important, and that clinical piece is really important. And then the other thing that we do is we spend so much time with our customers, and we make sure that we really root our product in education, because we can have the best test in the world, but if you don't understand how to use it, what the heck is the point of it?
And I
So in
think that was
addition,
one of the things that came up when we first started talking about the vaginal biome. Okay, so when I find out what it is or what's not right or what's not balanced, then what? And I think years ago we had the same thing with pH. That conversation started a long time. I can measure something, but if I don't know how to use it diagnostically, is it valuable?
Totally. And honestly, so much of the brand came out of like exactly those kinds of questions. So we now have, I think Jamie referenced this earlier, this huge educational component of what we do called Real Talk. And Real Talk was born because in the first 3 months of shipping out pregnancy tests, Jamie and I were sitting in a coffee shop, and Jamie was answering customer service email on the one shared email address that we were both using at the time because early startup days. And she was getting so many questions of, how do I know when to take a pregnancy test? My period's irregular. I'm on this hormonal birth control. How do I do this? And she's like, I'm just going to write a couple of articles and so I can send them to people when they ask these same questions we're hearing over and over again. And that honestly took off. And now it's got a community of 500,000 women, as 900 plus medically reviewed articles. It has become this whole world of its own because we listen to what our customers need. We've seen this hold true 7 years later with emergency contraception.
That's where I
And
was going to go, because that is such an exciting initiative. It is having been in women's health on the business side for so long, you can't separate what's happening anymore. Policy, advocacy, regulatory, what's happening in our courts from the products you deliver. So share where the idea came from. It's amazing what you did and how quickly you did it with the fall of Roe v. Wade. So tell us the story.
Yeah, so about a year before the Dobbs decision in June 2022, we had a sense of where things were heading with the court, and our whole mission is to empower confident health decisions. And at the time, we were really focused just on like vaginal and urinary health. And like you said, you can't ignore what's going on with policy and in the courts. And we knew that being able to provide emergency contraception was going to be more important than ever. So we really got to work on what is now Restart, our morning after pill. And we launched it the month of the Dobbs decision occurred. And that was a really interesting experience. It was, not the outcome we were hoping for, obviously, with the Supreme Court. But after that happened, we realized that one of the biggest issues with emergency contraception isn't the product itself, it's the education around it. So we were like, after we launched it, so many people, highly, highly educated people, like people who even worked in like healthcare were like, can you sell that? Like, isn't that illegal? And we
It's a
have to
little
explain.
terrifying.
Yeah, and we still have to explain all the time. Yes, it's legal in all 50 states. It is not the medical abortion pill. It prevents pregnancy. It's safe and effective, the whole spiel. And we really rooted our entire marketing strategy in that. So we did a number of campaigns, plain and simple, just called emergency contraception is still legal. We put up billboards in college towns and red states, letting people know that. Even today on our packaging, it says very clearly morning after pill prevents pregnancy before it starts. You'd be surprised that a lot of the packaging out there says like levonorgestrel 1.5 mg. Like people don't know what that does or what it means. So we're really on a mission to make this product as accessible and just like clear as possible. And obviously, this election was not the outcome we hoped for. And it's going to be more important than ever to keep showing up with this product and being able to meet the demand. We saw our sales increase 36 times, or more than 900% following the election.
Of
And
that product in particular.
yeah. And the interesting thing about that too, on the business side, is people are buying, we sell value packs. So, 4 packs of emergency contraception at a time, which is not how you would assume consumer behavior would be for that product. It's the same
And
with
wasn't
know,
traditionally how
I'm going to
people thought
chime
of
in
this
here
category. Yeah.
because, again, we don't talk politics on this podcast, but I would like to remind people in an educational way that the morning after pill or Plan B or whatever brand is available is, of course, not an abortifactant, but it's also not birth control. So I would suspect that people buying this in bulk are also perhaps using it as birth control, which is really, I just wanted to make a comment that that's not ideal because the risk of pregnancy is way, way higher than any other form of birth control other than none to use that as birth control. So just to a clarification.
Totally. And what's been really interesting is we have seen the women stocking up really as a way of doing something preventatively. We're hearing from moms in Texas and college age students in Ohio, places that they want to have this product on hand just in case. So 100% not birth control, nor should it be used like your primary source of birth control. And,
Yeah,
women are not stocking up to use it that way, at least not in our community.
I
It,
hope not.
yeah,
Yeah.
instead what we're finding is that women are worried about access to a piece of their health care, and they're just like using this as a preventative measure. So
Sure,
I
sure,
think they're
100%.
sure.
also
And
worried
I
that it
think
will
something
be.
else that is, sorry, James, something
We're all
else
very excited, right?
I know. Well, I think, coming back to this idea of education
Yeah.
and what had happened to our sales post-election and what we've seen happen to our sales. I mean, when the Florida Amendment 4 was introduced, we saw sales spike in Florida. Obviously, Roe v. Wade, we saw a lot of stuff, a lot of huge spikes in demand happen there too. We've seen it as abortion measures have popped us up across the country. But while our sales spike, the leading brand in this space, every time abortion is restricted, they see their sales fall. So they see the exact opposite thing happen because back to what Jamie was saying, most people think that the morning after pill is the same thing as the abortion pill. So they associate them so closely, and there's not enough education being done that those sales fall. And so it's not just from a activism perspective or a social perspective. For us,
Yeah.
education is just good business, not just the right thing to do.
Oh, 100%. I don't think you'd have a 500,000 followers in your under your belts if you weren't providing great education. I'm curious, do you have any metrics that are looking at results? I don't know, like perhaps a decline in office visits, decline in telehealth visits, decline in hospital visits as a result of your, amazing access. I don't know if that's a measurable item.
That's such a good question. The test and treat, so these digitally integrated products just launched this summer. So I don't have the specific stats yet, But now I'm such a data nerd. I'm like, ooh, all the research we're gonna do on that. So thanks for asking.
Uh, Well, the other question I have for you really revolves around all of the antibiotic resistance that's out there, particularly for
Yes.
UTIs. And how does your platform handle that? Like, I noticed your products and they're great. Some of them are similar to other things that are over the counter and available, and some are super unique. But how is that being managed?
Yeah, honestly, that is such an important thing. I feel like people don't talk about how dangerous it is to take the wrong medicine or think you're treating the wrong thing. And that's why we do testing as the first step to anything. So, actually, to access a prescription, you need to send a photo of a test indicating a positive result. So, they don't just take your word for it, they don't just look at symptoms or that self attestation. You need that actual physical
Yeah.
result.
But it's not a culture, and I don't
It's
mean to
not a
press you
culture.
on this.
No.
It's just such an
Yeah,
important thing in my world.
totally.
So, or is there some sort of follow-up if somebody is not getting better with what they may have been prescribed as a proxy for potential
Yeah.
resistance?
Yeah, definitely. So, we also are super aware that telehealth is a great first step, but medicine and bodies are very complicated. And so you do sometimes need a culture test, or you do need to even sit down face to face with a physician. And so if you have any complicated symptoms, so if you have any, aching in your stomach area, for example, with a
Yeah.
UTI, or curious looking discharge that doesn't align with like a really straightforward diagnosis, we recommend seeing a provider for exactly that reason.
Yeah.
Wonderful
Great. Thank
questions.
you.
Yeah,
Yeah,
it's
and
like honestly, we should all be pushed on these things because telehealth, digital health, it's like kind of the Wild West in so many ways, and we have to hold
Yeah.
ourselves to these high standards of care in order to ensure our community is getting them because nobody else is going to protect them. So I love it.
Jamie, it sounded like you wanted to jump in.
yeah. Just in that async conversation for both UTI and yeast infection, one of the questions is about have you had recurrent infections? Have you had this before? What medication have you taken in the past? So there is a level of questions and answers provided to help curb some of that. But like Cynthia was saying, with telehealth, it can only get you so far, which is why we like it as like a point of access.
Yeah.
I
Like,
mean,
would
to
your
be fair, even in the general clinical setting, we treat UTIs over the phone. We don't necessarily have somebody have to come in. So, but you're 10 steps ahead.
And, it's preaching to the choir. Alyssa loves this kind of thing because one of the themes that we see is we want to make sure that the healthcare practitioner is not taken out of the loop. And it's very different saying we're replacing the physician, which you're clearly not, versus we're arming our professional with more information to better treat our particular concerns.
Yeah.
I want to make a fast left turn towards the business piece. You can't be in women's health for as long as Alyssa and I have without hearing, the issues around fundraising. How did you manage that? How have you raised money? Have you had to raise in this last environment where many, many founders are pulling their hair out because it's so difficult right now? And it sounds like at a minimum, you would need to raise money to support your inventory and your growth.
So we have raised, we're a VC-backed company. We are lucky to have not raised this hair pulling environment. We last raised kind of leading up to the launch of Restart, but since then have been able to use our cash flow to fund the business. So breaking profitability this year. So much of that comes from education fueling our growth. We're not pouring billions of millions of dollars into Meta each year. We're really owning what customer acquisition looks like. They're coming to us to get their questions answered, and we're giving them the actual product that they need to solve that as well. And that's been really helpful. It's a tough fundraising environment. And so we're really lucky that we haven't had to go out there right now.
And when you look at your growth, is it primarily new products or are you increasing the lifetime value of your existing customers? Because once they trust you, I would imagine that's exactly the kind of customer you want. If you help me with my UTI, when I think I'm pregnant, you're the people I'm going to call. So when you think about the growth, where's the real focus or is it on both?
Distribution, distribution, distribution. It's all about getting our products in front of as many people that need them.
Got it.
And
I'm just
okay.
curious about the award you got,
Mhm.
and I understand there were other awards in your coffers. Can you talk a little about that?
Yeah, I can jump in.
Great.
We just were awarded Time Best Inventions for UTI test and treat, and that was a really exciting moment for us and kind of a like I don't know if full circle is the right word, but
Pinch me
we
moment.
yeah, pinch me moment. Because, like Cynthia and I have been saying, we launched with just like a basic pregnancy test. And we've really been pushing ourselves to make something more innovative and more special for consumers. So that was a really exciting one. And I think they chose 200 people and there were like thousands submitted. So very grateful to be on that list. And we've also been awarded Forbes 30 Under 30 a few years ago. Well and Good, no longer under
Amazing.
30. Well and Good Change Makers, as well as Fast Company Most Innovative Companies, I think it
Mhm.
was. And an Ad Age Breakout Brand Leaders. So lots of, I mean, the awards are, it's fun, to be able to even
Of
like submit
course.
ourselves for them. It's a time to reflect on the work that we've done. And always a good reminder to, that the work we're doing is impacting people. It's really easy to be in the day to day, as you guys know, and just like heads down, focused on the next thing. So it's a nice little moment to come up for air.
Amazing.
So I want to ask one more question about competition. You're not alone, obviously. Thank goodness. What we often
Yeah.
hear from founders is, listen, there's so many needs, there's so many people. No one company or 10 companies can do this alone. Um, how do you think about, I know you differentiate from education. Do you keep one eye on the competition and what they're doing, or are you mostly, like a lot of founders do? How do you think about the competitors? Do you ever collaborate? Because women's health is quite unique in that competitors do collaborate in this space because we always talk about this rising tide and raising all boats.
We do so much collaboration, and Jamie can talk all about what that looks like on the brand side of the business. But you said this in the beginning, like, I mean, women's health is huge. Just look at how much money Jill Biden just gave, hopefully, to women's health and, to supporting initiatives there. So I think it's really easy to look at a tampon company and a company like ours and say, oh God, two women's health companies. But those are vastly different things, right? Like if you looked at an ED and a shaving company, you would never think they are the same thing as each other. We lump women's health so closely together.
Fair
Um,
analogy.
That's
yeah.
great.
Like there's room for so many people at the table. And I think something that's really different about women's health, the reason why you see so much more collaboration is that I think you don't work in women's health without having a mission behind what you do. It's really different than whatever, just a CPG company out there. I think we're all really motivated by a combination of doing well and doing good and creating access to whatever it is, the specific thing that we're focused on. For us, our big differentiator is around at-home diagnostics. It's around the language that we use to connect with our community. It's around, building this peer-to-peer relationship, and it's around education. But a tampon company, a menopause company, a sexual wellness company, like we're all at the end of the day building towards something a lot bigger. So it's definitely not a zero-sum game, whatever the other sports metaphors are. We're all part of things in her toolkit. And so us working together, I think rising tides lift all ships.
Yep, we love that expression. Well, you guys are a breath of literal fresh air. We will be watching with bated breath. Anything coming down the pipeline that you care to share? Anything new or novel?
Yeah, we are very focused on getting into retail locations. So keep an eye out for Wings products on a shelf near you. And like Cynthia was saying earlier, we post tons and tons of medically verified, sometimes legally verified and reviewed sex education on our site, Real Talk. So we amplify all of that through our social channels. So follow along on Instagram and TikTok. Lots of good stuff happening over there.
Well, that's awesome.
Fantastic.
I think it's
Yeah.
one of my favorite parts besides your metaphor was you were looking wistfully at being under 30. So I can only, you can only imagine. Anyway, keep up the good work. You two are amazing. You're a power duo and we wish you continued success.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.